This video is going to be a demonstration on how to perform a RF agglutination test kit. We'll be performing this test to determine the presence of IgG-RF in the patient's serum indicating rheumatoid arthritis. Before you begin, you want to make sure you have on clean gloves and your lab coat. Once you have received your patient specimen, you want to ensure that the last name, first name, and medical record number on your lab log matches up with the labeling on your patient specimen tube. Now you can document on your lab log that the patient specimen was received. The supplies you'll need to perform your test are your log sheet, a chem wipe and a pipette, your patient specimen, your test kit, and 2 wood sticks. Now you can open up your test kit and ensure you have everything you need. You'll need your package insert, your negative control, latex reagent, positive control, and your test card. While you're performing your test, you want to be sure to observe your clean area where your lab log is and your dirty area where you'll be performing your test. Since we are using a reusable card, we need to indicate on our log sheet which whale will be for our positive control, our negative control, and for our patient specimen. Before you begin the test kit, you want to observe the patient's serum and document in the comments section of the log sheet if it is icteric, lipemic, or hemolytic. In this case, we would document 1+ hemolysis present. Be sure to dispose of dirty gloves and put on clean gloves in between handling a specimen and documenting on your log sheet. Now you can locate the procedure section in your package insert. Note that it instructs this test kit be brought to room temperature before continuing. Once your test kit has sat at room temperature for the designated amount of time, you can begin. You'll want to take both of your controls and your latex reagent and gently invert them several times to mix the contents. Begin your test kit by taking your positive or negative control and placing 1 drop in the whale indicated on your lab log. To collect the patient's serum with the pipette, you want to begin by taking a chem wipe with your tube and place the chem wipe on the lid of the tube to pull up and prevent any aerosols. Now you can take your pipette and collect the serum, being careful not to mix it with the red blood cells. Now you can place 1 drop of the patient's serum onto the whale indicated on your lab log for the serum, and be sure to place it slightly to the left. Using your chem wipe, you can now recap your tube. Now you'll take your latex reagent and place a drop in each whale slightly to the right, avoiding placing it on top of your controls or your patient specimen. Now you can take 2 wood sticks and snap them in half so that you can have enough to mix each whale. You want to mix each whale starting in a circular motion and working your way out until you cover the whole whale. Discard of each stick in the sharps and get a new one for each whale. Go ahead and set your timer for 2 minutes. Now you're going to rotate your test card for the whole 2 minutes, being careful not to let the contents of one whale spill out onto another. After the 2 minutes is up, you can now observe for agglutination. You can tell by the latex particles clumping around whale number 1 that our positive control agglutinated. Our negative control in whale number 2 and our patient specimen in whale number 3 are both smooth and glossy, indicating no agglutination. This tells us that our patient specimen is negative for IgG-RF. Before you begin documentation, you want to dispose of your dirty gloves and the biohazard and put on clean gloves. Now you can begin filling out your lab log. Beside RA factor, you want to describe in the second column whether your patient's results were positive or negative.
In the third column, you want to give a description of your result, whether agglutination was present or not. For both the controls, you want to document the same as you did the patient specimen, documenting positive or negative in the second column, and then in the third column, giving a description of the result. For your normal reference range, you want to document negative and no agglutination present. For the method, you want to document latex agglutination.
Now that you're ready to clean up your workstation, you want to dispose of everything that is not considered a sharp into the biohazard.
When you're done documenting everything else, you can go ahead and document that your patient's results were reported with your date, time, and initials.
In the case that you're using a reusable test slide, you want to cover both sides with 10% bleach, then rinse with water. Then you want to gently blot your test slide to dry it. Now you can reassemble your test kit with your test slide, your package insert, your positive control, negative control, and latex reagent. Make sure to check your package insert to determine if refrigeration is needed for your test kit. Now you can refrigerate your patient specimen and your test kit if needed. Now you can clean your work area with your 10% bleach solution. Cover your work area and then wipe it clean and dispose of your paper towels in the biohazard. When you're done cleaning your workstation, be sure to dispose of your gloves in the biohazard and perform proper hand hygiene.